These are notes on water and foodborne illnesses that are reportable diseases. Part 1. Let's start with gastroenteritis outbreaks in institutions and public hospitals. These can be caused by many pathogens, by affecting the GI tract through consumption of contaminated food or water. And then these pathogens can be transmitted fecal-orally or can be person to person. That being said, any sort of GI outbreak in an institution is a reportable incident. So a confirmed outbreak in a gastroenteritis institutional outbreak would be 2 or more cases meeting a case definition with a common epidemiological link. The common link could be a specific floor or unit, same caregiver, and these have to be within a 48-hour period. A suspect outbreak, we must notify the health unit. So the hospital should notify the health unit, who will support and investigate the investigation. We also have to exclude any cases that may be experiencing GI symptoms because of medication. Some medication can produce diarrhea. A case is defined as 2 or more episodes of diarrhea within 24 hours, or 2 or more episodes of vomiting within 24 hours, or an episode of diarrhea and vomiting within 24 hours. The first reportable disease we're going to talk about is botulism, caused by Clostridium botulinum, specifically the toxin it produces. It's an anaerobic gram-positive spore-forming bacteria that produces neurotoxin. Most strains produce one type of toxin. Clostridium perfringens does not cause botulism. However, Clostridium botulinum does. Clostridium botulinum grows well in low oxygen environments, so specifically like canned foods. Illnesses usually happen from improperly home canned foods. Also, botulism is a bioterrorism agent. Symptoms. There are 3 main forms of illness depending on transmission. All cause flaccid paralysis. The first type of disease is called foodborne botulism, and it is intoxication from ingesting food contaminated by the neurotoxin. It can cause dizziness, blurred or double vision, and a dry mouth. Specifically, it can cause cranial nerve impairment or a lazy or drooping eye. It also produces nausea, vomiting, diarrhea, and fatigue. The next disease botulism can cause is wound botulism. It's when spores penetrate an open wound and produce a toxin. It's similar to foodborne botulism, but can take weeks to appear and can reach other parts of the body via the bloodstream. It also can cause gas gangrene in the skin. The last type of botulism is infant or adult botulism, also called intestinal botulism. It happens when spores are ingested and toxins are produced in the intestines. It can affect children under 1 year old and adults with altered gut floras. In children, it produces poor sucking, weakness, altered crying, and loss of control of their head or a floppy head. So botulism can cause paralysis and death. And transmission for foodborne botulism is primarily through improperly canned or improperly stored food that has the toxin. Usually canned food or salted or smoked fish or home canned food. Wound botulism, again, contaminates tissue. It's common in IV drug users. Intestinal botulism or infant adult botulism happens when spores germinate in the colon and produce toxins, usually present in unpasteurized honey and peanut butter. The incubation period of foodborne botulism is 12 to 26 hours. Can be days after consuming food too. Wound botulism is 4 to 14 days. And for intestinal botulism, it's up to 30 days. The reservoir for Clostridium botulinum spores are usually in soil. It's ubiquitous in soil and can be found in honey, produce, marine sediments, intestinal tracts of animals, fish, canned food, and usually contaminated before sealing. And again, some sources of botulism or Clostridium botulinum are when food processing allows for the survival of spores and food is not reheated before consumption. Reheating again would kill cells. Food with pH above 4.6 can support growth and toxin production of botulism. Salt concentration is also needed to inhibit spores. There are no visible signs of contamination, but signs can be swollen cans. Other common sources could be luncheon meats. Again, those are usually canned. Salted fish, home canned foods, and honey is the main reservoir for intestinal botulism in infants. Children under 12 months shouldn't be fed honey. Confirmed cases are usually symptoms with lab confirmation, detection of toxin or food in food or stools. For wound, it's detection in blood or wound samples or tissue samples. For intestinal botulism, it's symptoms with toxin in serum, and it also depends on the age of the patient. You can also isolate botulinum in stools. A probable case is symptoms and a link to a lab-confirmed foodborne case. A suspect case, it's evidence approved by the MOH without having an EpiLink or testing. So it's case-by-case basis. Since botulism is a serious disease, a single case is treated as an outbreak. Some case management work we need to do with botulism is to obtain food histories, history of other risky behaviors or exposure to injury or drug use, collect food samples or stool samples from suspected sources of intoxication. Botulism may be used as a bioterrorism agent, and we should contact the Provincial Emergency Operations Center if there is suspicion of bioterrorism. If sabotage is suspected, the police should also be contacted. So for treatment of botulism, you use botulinum antitoxin, which is obtained from the Chief Medical Officer of Health's office. So it's very hard to get. Specifically, Baby Big for infant botulism is not approved in Canada and is only available from California Public Health. Antibiotics are not recommended to treat botulism because it'll kill the bacteria, which will release more toxin. So, contact management. Obviously, it's best to consult a healthcare provider, but for outbreaks, it's not common, and one case, again, should be treated like an outbreak. Prevention of botulism. For foodborne botulism, it's important to handle food safely, canning things properly, refrigerating food and refrigerate food stored in oil, follow storage and shelf life labels for food, avoid canned or bottled foods that are dented or leaking or suspected to be tampered with. For wound botulism, it's best to avoid IV drug use. For infant botulism, just avoid feeding babies under 1. Avoid feeding them honey. The next disease is Campylobacter enteritis. Campylobacter is the third leading cause of foodborne illness in the U.S. Symptoms last 2 to 10 days. It can produce diarrhea, which is sometimes bloody, vomiting and cramping, which usually occur but usually go away. Campylobacter jejuni is a non-spore-forming gram-negative bacteria. It can grow in low-oxygen environments. It's a fragile bacteria, meaning it struggles to grow at ambient temperature and difficult to culture in laboratories. That being said, Campylobacter jejuni is susceptible to drying, heating, freezing, disinfectants, and acidic environments. Symptoms of campylobacteriosis are abdominal pain, fever, nausea, and vomiting. Blood and mucus can appear in stool, and it can mimic appendicitis. It can be asymptomatic, and relapses can occur. Some complications of campylobacteriosis include Guillain-Barré syndrome, which is an autoimmune disorder, encephalitis, and it can cause miscarriages. Transmission. So it can be transmitted, it can be foodborne transmission through the ingestion of undercooked meat and poultry, under pasteurized milk and dairy products. That being said, cattle can be carriers as well. Improper food handling and cross-contamination. Direct contact or zoonosis can happen through contact with infected pets. Waterborne transmission can occur through the ingestion of contaminated water. Incubation is 1 to 10 days, and the period of communicability is days to several weeks. Campylobacter can be present in feces. Reservoirs for Campylobacter are commonly poultry and cattle. It's a normal part of it's a natural part of their gut flora, and most commonly through raw contaminated poultries. Puppies and kittens can also be reservoirs for this bacteria. Swine, rodents, sheep, and birds as well. Major sources of infection can come from raw poultry, under-pasteurized milk and cheeses, unchlorinated and contaminated water. It can also be found in meats and seafoods and vegetables, improperly handled undercooked poultry, and unpasteurized cheese. So a confirmed case is isolation of Campylobacter in a stool sample with or without symptoms. Probable cases are symptoms with either an epidemiological link to a case that's confirmed or a NAT test. Case management, so it's important to provide education on the illness and how to prevent reinfection, and we should exclude symptomatic food handlers, healthcare providers, and daycare staff and attendees until 24 hours symptom-free or 48 hours after completing antibiotics. Contact management, it's important to assess household contacts and advise them to seek medical care. For outbreaks, 2 or more cases that are linked to a time or common exposure as an outbreak. If it's multi-jurisdictional, we have to activate the Ontario Foodborne Illness Outbreak Response Protocol, or FEORP. Some prevention is to minimize cross-contamination by washing hands, sanitizing food contact surfaces, and avoiding contact between produce and ready-to-eat foods with raw juices, proper hand hygiene, proper cooking temperatures, consuming only treated or boiled water, avoid unpasteurized product, safe food handling, and water chlorination. So let's talk about Salmonella. Salmonella species can cause 2 types of illness, both of which are reportable in Ontario. The first type of illness is salmonellosis, and the second type is typhoidal illness. So let's talk about salmonellosis. It's caused by the bacteria of the genus Salmonella. There are 2 main types of species of non-typhoidal Salmonella. There's Salmonella enterica and Salmonella bongori. Salmonella enterica consists of Salmonella enterica, Enterica salme, Enterica arizona, Enterica d-arizona, Enterica hutinae, Enterica indica. That being said, most infections are caused by Salmonella enterica. Salmonella bongori is the other type of salmonellosis causing salmonella, and it's usually found in the environment and cold-blooded animals. Bongori could be the cause of salmonella from reptiles. Some symptoms of salmonellosis are sudden onset of diarrhea with abdominal pain, fever, nausea, and vomiting, usually self-limiting for about 7 days, and it can also be asymptomatic. Complications include dehydration and can occur in vulnerable populations, as well as blood infections. Incubation period of salmonellosis can be 6 hours to 7 days, but usually 12 to 36 hours. Transmission. So it depends on the kind of Salmonella bacteria. It could be the bacteria in humans, which would be Enterica, or animal GI tracts, or on reptiles, which would be Bongori. So ingestion of contaminated food, animal origin, meat, etc. So raw and undercooked poultry, underpasteurized milk or unpasteurized milk, eggs, meats, processed foods, and pet foods. Contaminated water, so water that's not properly disinfected. Fecal oral transmission, so the food handler's not properly washing their hands, and it's common in institutional settings. Pets can also spread Salmonella, specifically turtles, reptiles, and chicks. Period of communicability is throughout its infection, so 3 to 4 weeks. Reservoir for Salmonella are domestic and wild animals, specifically chickens, reptiles, amphibians, swine, cattle, small ruminants, rodents, pets such as dogs, cats, and hedgehogs. Infected humans can also be convalescent carriers, so they can continually shed the bacteria. Again, some common sources of Salmonella are from inadequately cooked poultry or food containing eggs, beef, pork, and turkey, raw milk and dairy products, dried dairy products, sprouts, contaminated fruits and vegetables, flour, peanuts, salami, petting zoos, farms, fairs, and childcare settings. A confirmed case is signs and symptoms with the isolation of Salmonella. Probable case is symptoms with an epi-link to a confirmed case. Case management. So info we need is food history of the case, exposure to animals, exposure to others with salmonellosis, their occupation. Do they have contact with vulnerable populations? That being said, we should isolate or rather exclude food handlers, healthcare workers, and childcare staff and attendees for until 24 hours until symptoms are better. That being said, there are multi-drug resistant Salmonella in Mexico. Other case management things we should do are history of visiting animal shows or farms. Are we able to collect food samples or stool samples? And what treatment is being done? Speaking of treatment, antibiotics is not known to shorten infection. It can prolong diarrhea. The best thing to do is do supportive therapy through rehydration. So for exclusion, asymptomatic food handlers should be excluded if they don't follow safe food handlings. It depends on what their duties are. Do they prepare food for vulnerable populations, or can they be reassigned to low-risk activities? So contact management, we should educate about transmission and hand hygiene to household contacts. Prevention would be through minimizing cross-contamination between poultry and ready-to-eat foods, hand hygiene, proper cooking, avoiding raw sprouts for high-risk populations, avoid handling food when ill, treating or boiling water for consumption, avoiding raw undercooked eggs, that being said, dirty or cracked eggs, limit time in the temperature danger zone for 2 hours, and contact precautions for incontinent patients. Paratyphoid fever is the other illness caused by Salmonella species. Paratyphoid fever is caused by Salmonella enterica paratyphi, A, B, or C, commonly called Salmonella paratyphi. It's important to note that typhoid fever is caused by Salmonella typhi, aka enteric fever. It is more common in developing countries. Paratyphoid fever symptoms include the gradual onset of a sustained fever, headache, malaise, anorexia, abnormal heartbeats, non-productive coughs, rose spots, and enlargement of spleens. Complications include intestinal damage, leading to the gut leaking to the body. Incubation period is 1 to 10 days. Foodborne transmission occurs when you consume contaminated food or water, contaminated milk products, from cross-contamination from fly vectors, if you consume shellfish from contaminated waters. Foodborne transmission occurs when you ingest contaminated water. Period of communicability is as long as organism is excreted, and it's throughout the illness and can be 2 weeks after onset. Reservoirs are humans and possibly domestic animals. Sources are usually from improper food handling. A confirmed case is signs and symptoms with the isolation of Salmonella paratyphi A, B, or C. Probable cases are signs and symptoms and an epilink to a confirmed case. For case management, some information to get are some about history of travel, contact with recent travelers to endemic countries, food history, close contacts. We should be educating on hand hygiene and follow up on their antibiotic treatment. Exclusions, so food handlers, healthcare workers, daycare staff, and attendees should be excluded until they have 3 consecutive negative stool samples 48 hours apart, and after 48 hours of completing antibiotics, 2 weeks after completing strong antibiotics, getting approval from a doctor. It's also important to refer to a doctor if traveling to get prescriptions. An excreter is someone who continues to shed Salmonella paratyphi after 6 stool samples. Not working in high-risk settings. So if someone's not working there, just educate them about testing to ensure clearance of the organism. Emphasis on personal hygiene. So, contact management. A symptomatic contact is someone, we have to exclude them if they are food handlers, healthcare workers, or daycare staff until 2 consecutive negative stool samples. If they are a positive stool sample, they become a case. Asymptomatic contact, we require them to give us 2 negative stool samples. No exclusion required at all if they're asymptomatic. Prevention of Salmonella paratyphi or typhoid paratyphoid fever are proper hand hygiene, proper practice of food safety, avoiding unpasteurized milk, proper cooking of shellfish. Hepatitis A is caused by the hepatitis A virus and can be transmitted through the consumption of contaminated food or water, or contact with contaminated blood, or through sexual contact. The hepatitis A virus is an RNA virus and can survive on surfaces, and it is an encapsulated enterovirus. Symptoms include acute self-limiting liver infection, an abrupt fever, anorexia, nausea, and abdominal pain, as well as jaundice. Children under 6 are usually asymptomatic and don't develop a jaundice, where older children and adults do produce jaundice and dark urine and have an abrupt fever, malaise, and loss of appetite. Some complications are that it can lead to death from liver failure, and it can lead to prolonged hepatitis or a liver infection. High-risk groups include older people, those with liver disease, and immunocompromised. Incubation period is usually 15 to 50 days. Transmission, fecal-orally, is through ingestion of contaminated food, direct contact through contact with blood, sexual contact, anal-oral sex, men who have sex with men, drug use, and through childcare settings. Period of communicability. The max communicability is 2 weeks before the symptoms. Communicability slows or lowers after jaundice is produced, usually 7 days after jaundice, and it can be 6 months for infants. Reservoirs, usually just humans. Sources are through the ingestion of contaminated food or water. A confirmed case is symptoms of jaundice and no history of hepatitis A vaccination, hepatitis A antibodies, and an epi-link to a confirmed case. Probable case is acute illness with an epi-link to a confirmed case. Case management work that includes asking the cases when jaundice started, determine dates of infectious periods, so 14 days before onset until 7 days after jaundice, identify potential contacts, determine if the person got hepatitis A vaccine recently, to eliminate false positive from vaccinations. Other risk factors are travel history, food history, contact with a Hep A person infected with Hep A, if they attended or are an employee at a childcare setting or institution, men who have sex with men, intravenous drug users. When we educate, it's important to educate about transmission and personal hygiene to prevent secondary transmission. Exclusion. So again, we should exclude food handlers, childcare staffs, and attendees, healthcare workers until 14 days after symptoms or 7 days after jaundice. Exclusion, normally not warranted for asymptomatic, but is usually case by case. Post-exposure prophylaxis include the Hep A vaccination or serum immunoglobulin offered to household contacts. So prevention, ways to prevent Hep A infections are through vaccination for travelers, vaccination for children adopted from hepatitis A virus endemic countries, drug users, men who have sex with men, people with liver disease or hepatitis C, military personnel, zookeepers, researchers. And also it's important not to donate blood if you have hepatitis A.